Welcome to the virtual Women and Gender in International Development discussion series at Virginia Tech. Everybody please say muted or we get a lot of noise across us. So anyway, as of this morning, we had 85 people registered for today's event. So that's very exciting. Might be our highest number yet, Cedra. So besides lots of students, faculty, and staff from Virginia Tech, we have folks joining us from other U.S. universities, University of Texas at Austin, my alma mater, UC Davis, and Emory University. And a special shout out to Dr. Zayer's Global Feminisms class, who is joining us. And we have several other organizations in the US, including Cultural Practice, DAI, and USAID, as well as folks from other organizations in Pakistan, Ireland, and Sudan. So welcome to everybody. So please note that our event will be recorded. Pratiraksha, please press record. Okay, so if you, and it will be available on our website later. So if you, by staying on, you are consenting to be recorded. You can turn off your camera if you do not want your image to be recorded. So before introducing our speaker, I invite you to reflect on Virginia Tech's land and labor recognition. So I'm going to read a shortened version, but actually will put a link to the full version in our chat. So Virginia Tech acknowledges that we live and work on the Tudelano-Monacan people's homeland, and we recognize their continued relationships with their land and waterways. We further acknowledge that the Morrill Land Grant College Act of 1862 enabled the Commonwealth of Virginia to finance and found Virginia Tech through the forced removal of Native nations from their lands in California and other areas in the West. We also recognize that enslaved Black people generated revenue and resources used to establish Virginia Tech and were prohibited from attending until 1953. Through inclusive VT, the institutional and individual commitment to ut prosum, that I may serve, in the spirit of community, diversity, and excellence, we commit to advancing a more diverse, equitable, and inclusive community. Now, some brief housekeeping notes. This event will last approximately 45 minutes. Our speaker's presentation will be 20 to 25 minutes, followed by about 20 minutes of discussion and Q&A with the audience. All of the participants will be muted, and we're asking you to keep yourself muted to enable the speaker to present without interruption and background noise. As always, in order for our discussion to be as rich as it can be, we need everyone to be respectful and treat all participants with kindness and consideration without discriminatory behavior. If anyone is disrespectful, including interrupting the speaker or bringing in off-topic issues, we may have to remove them from the Zoom meeting. You can post your questions in the chat anytime, and I can read them. We put them into a Google Doc and I can read them at the end. Or if you want, at the end, when the speaker has finished her presentation, you can raise your hands virtually and then I'll call on you so that we can I'll ask you to unmute yourself so you can talk directly to the speaker. But please wait your turn to speak so that we can avoid interruptions and maintain netiquette. So again, the webinar is being recorded and you will have access to it in our past events archive later. If you would like to enable captions, at the bottom of your Zoom screen, you can find the options, more, and select it, and then select show captions and select English. That would be helpful for you. So in advance, I would like to ask that you please answer the survey that will be shared in the chat at the end of the event, and it will also be emailed to you. It's very helpful for us to get your feedback for our planning and our funding. And now to introduce the speaker. So Ms. Sidra Khalid is a national researcher at the International Water Management Institute. She's an experienced international development practitioner and researcher in gender and social inclusion. Throughout her career, Ms. Khalid has led projects across diverse sectors, including WASH, reproductive health, livelihoods, and women's empowerment, championing gender equity and social inclusion. She's worked with renowned organizations like CARE and Save the Children, leading and contributing to gender transformative programming, including authoring a gender equality curriculum for young adolescents in Kyrgyzstan. Sidra holds a master's degree in development practice from Emory University and a bachelor's degree in sociology from UC Berkeley. Ms. Khalid is currently based in Pakistan, working as a gender and social inclusion researcher with the International Water Management Institute. Her research there focuses on gendered and social vulnerabilities in the water sector, covering topics such as climate change, water management, health, food security, disaster reduction, energy poverty, and sociopolitical norms shaping decision-making and access to and use of water resources. And today she will present findings from a study that examines factors affecting water security in urban Pakistan through a gendered lens. The title of her talk is Who is More Water Insecure? Gendered Evidence from Urban Pakistan. Please welcome Ms. Sidra Khalid, and she will share her screen. If you have any problems seeing, my computer was having some problems, but other people's weren't, just please send me an email or chat rather, and I have her PowerPoint and I can share it from my computer. So, okay, welcome, Sidra.
Thank you, Maria. Can you just confirm if you can see my screen?
I see it well, so that means others probably can see it.
Okay, thanks. So good afternoon, everyone, and good evening from Pakistan. So I'm Sidra Khalid. I'm working as a GESI researcher with IMI here in Pakistan. And today I'm going to be sharing some interesting research findings from a study we conducted in 2 urban towns under a research project.
Okay.
So before I begin, I just want to give a bit of context for those of you who aren't familiar with Pakistan and its water security and climate vulnerabilities. So Pakistan's the 5th most populated country in the world with an annual growth rate of 3%. It's ranked as critically insecure in the UN Global Water Security Assessment. And it's one of the top 10 most vulnerable countries to climate change, number 8, actually. So the economy is mainly dependent on the agriculture sector. So 95% of our water goes towards the agriculture sector, and the remaining 5% is used
let me know when it's done.
The remaining 5% is used towards domestic and industrial use. So the country is rapidly urbanizing. It has one of the highest rates of urbanization in South Asia. Around 40% of the population is now in urban areas. So this is increasing the demand for domestic and industrial water use. So from estimates suggest that this demand is going to increase from 5% to 15% within the next few years. So of course, all of this is exacerbated by climate change. And we're seeing a lot more increased burden on water supply, water quality, infrastructure, and management systems, especially in urban areas. So in terms of some WASH statistics that would be useful to know, only around 40% of people have access to safely managed water and 58% to basic sanitation. And one of the biggest issues is lack of funding for WASH service provision. So estimates suggest that if Pakistan were to meet its WASH SDG targets by 2030, it would need 450 billion Pakistani rupees, which is approximately 1.6 billion US dollars annually. And for comparison, the WASH budget in 2023 was only 265 billion. So you can see there's a huge gap in funding. The country also has a lot of issues with water quality. We rank 80 out of 122 in terms of drinking water quality, and there's high prevalence of waterborne diseases. Again, this is all exacerbated with climate change and climate extreme events like flooding and droughts. So around 30% of all diseases are contributed by poor water quality, and 40% of deaths are attributed to water issues. And then in terms of sanitation and wastewater treatment, it has really, really low rates, unfortunately. Barely 1% of domestic and industrial wastewater is receiving treatment in the country. So in terms of the gender situations, particularly in the water sector, so overall, Pakistan does not do well in terms of gender equality scoring. So in the Global Gender Gap Index, the latest 2024 score, it's the second to last country, just above Afghanistan. It's actually dropped 3 points since 2023, where we used to be 143. And in terms of the 7 countries in the South Asian region, it's the lowest, so number 7. So in Pakistan's context, women and girls are disproportionately bear the burden of water insecurity. So this can look like increased time burden for water collection. This has impacts on their mental health and stress, reduced education opportunities, and increased vulnerability to gender-based violence. And poor wash access also increases the risks of waterborne diseases. And then particularly for those who menstruate, it compromises menstrual hygiene management. And this is also linked to a reduction in economic opportunities and social participation. And then particularly in Pakistan, women's participation and decision-making in water management is very low, or if they are involved, it's very tokenistic participation. And we see largely that nationally gendered wash data is missing. We're not really collecting enough information on what's happening with men, what's happening with women, and other gender groups. So this is kind of the backdrop of what IMI is doing in Pakistan. And in this particular study, we really wanted to know, what are the different needs of different gender groups, specifically in urban communities and when it comes to WASH. So disaggregated data is so important because it tells us precisely these things: who has access to what, who doesn't. And if we really want to inform better policies that are evidence-based and gender transformative programming, we need to collect this information. And then in a broader sense, if we're linking this with the Sustainable Development Goals, right now the data that the government collects at the national level, it's either at the household level or just provincial wise. So no one's really collecting sex disaggregated data. So it's really hard to measure what actual progress we're making. So this is kind of where our starting point was for this study. And the fact that only 1/3 of countries in the world collect sex disaggregated data for water management, which is quite alarming. So to get now to the survey that we conducted, so we conducted a survey in 2 urban towns in Pakistan, in the capital city of Islamabad and its neighboring twin city of Rawalpindi. The 2 towns are called Farash Town, which is in Islamabad, and Jamestown in Rawalpindi. And really, this study was part of an ongoing research project that we're conducting in collaboration with WWF Pakistan. It's an Australian aid-funded project called the Australia-Pakistan Water Security Initiative. So we're already working in these communities. So we decided we really want to get this baseline assessment of what the WASH status is, and then particularly looking at this through a gender lens. So we surveyed a total of 560 men and women across both of these towns, using proportional sampling based on their population sizes, with equal numbers of men and women. And I will just point out that we only surveyed self-reported and self-identifying men and women. So those are the terms that I will use, but we acknowledge that there are diverse gender groups in Pakistan. And one thing I will point out, if you notice the maps of the towns, you'll see that Farash Town has a bit of a more grid-like organization and structure because it is in the capital city, whereas Jamestown is a bit haphazardly planned because it's not under the capital. So the Capital Development Authority, or the CDA, is also responsible for providing water supply to all areas in Islamabad, whereas in Rawalpindi, people have to rely on other sources. So I'm going to share just some of the general survey findings and then go into some of the deeper analysis that we did. So in terms of the drinking water sources, based on what I just mentioned about where the towns are located, most of the people in Jamestown are using filtration plants. and in Faraj Town, they're using public tankers. We also asked about how reliable or how available water was from these sources. And only around a quarter of households or individuals reported that water is available all year long. So there's lots of issues with interrupted water supply in these two areas. So we also asked questions about how accessible the water source is to people with disabilities or limited mobility, how people perceived the safety of the source for women and young boys and girls to access, and the mode of collection. So this was we got really interesting findings when we kind of did a disaggregated analysis. So in Jamestown, a lot less people reported the source as inaccessible, and the main source they use are filtration plants, while in Faraj Town, 45% reported their drinking source as inaccessible. And when you look at the sex disaggregated responses, you'll see in Jamestown more men are saying this, and then in Faraj Town, 74% of women are saying this. So the reason is because the one is filtration plants are just set in one location, so they're easier to access, whereas public tankers are they're mobile, right? So it just depends where they are. They might be women might be worrying more about distance or just where the public tanker decides to park. And then we also found that in Jamestown, men are the primary water collectors, while in Faraj Town, it's actually women who are the primary water collectors. So this may explain some of these differences that we're seeing. And then especially in terms of safety, where more people in Faraj Town are saying that the water source is not safe. And then in terms of mode of collection, also very interesting that majority of men in both the towns are collecting water through a motorcycle, and none of the women that we surveyed collect water through this mode of transportation. And if you're familiar with Pakistan, it's very, very unlikely that you will see a woman riding a motorcycle by herself. So this speaks to kind of time it takes to collect water, which increases women's time burden if they're walking versus using a motorcycle. So again, we kind of got different answers based on who the primary water collector is, what's the main source of drinking water, and how men and women are thinking about safety. So these are actually two pictures from Faraj Town. This is what the CDA public tankers look like. So you can see there's no organized lines. They're just kind of parked haphazardly. Men and women are both collecting water at the same time. So you can imagine in times when there's water shortages, the people who are, more aggressive or, pushing through the lines, they're the ones who are going to get water, which might explain why more women in Faraj Town reported issues of safety. So we also asked women who were menstruating some of the challenges that they faced. So alarmingly, nearly 40% of women are facing challenges due to water-related issues, causing them stress and difficulty. Around a quarter reported that they have limited access to water for washing and cleaning their bodies while they're on their period, and when they're changing their hygiene materials. And a lot of the women, so just over half, are using clean water, but it also means that a significant number were using unsafe water, which explains why we heard more women reporting issues with skin rashes and irritations. And there was a really interesting difference between how women were managing their periods inside their homes versus outside their homes. So 60% can easily manage inside versus 20, almost half of that when they're outside, it's more difficult, which kind of speaks to the masculine nature of public sanitation infrastructure, especially in Pakistan. And then very briefly, some of the other differences that we saw was men were more aware of community water issues. Women were not receiving as much information or trainings on water-related issues from NGOs in the area. And as I mentioned, women were experiencing higher prevalence of different waterborne illnesses. So we implemented in the survey something called the Individual Water Insecurity Experiences, or the IWISE scale. This is a globally validated tool with 12 questions related to different experiences with water insecurity. And if you score 12 or more, you're considered water insecure. So when we implemented the IWISE, you can see that both of the towns are way more water insecure than water secure. And you can see Farashtown is a slightly less water insecure, which we would expect because it is in the capital city and has a bit better infrastructure. So then, of course, we wanted to ask, well, does water insecurity differ across genders? And as you can imagine, it absolutely does. So across both towns, women are much more water insecure than men. And then even within, so across and then within each town, men are more water secure. So it's a really drastic difference that we can see. And this has implications that we can now share with, our government partners, people in the CDA, when they're thinking about different interventions that they would have otherwise not known if we were just presenting aggregate results. So we also then went a bit deeper and conducted a deeper analysis to identify the key factors influencing water insecurity. And we published a paper on this last month, which I'm happy to share in the chat after this. So we used a multivariate binary logistic model, and we're looking at how variables like gender, age, education, socioeconomic status, employment, if they're paying for water, what the drinking water source is, concern levels about water issues, overall satisfaction with water supply, and water quality perceptions. So these were all the variables, the independent variables we put in this model based on the survey data that we had. And we wanted to see, and we also calculated the marginal effects. So I'm not going to show all the equations and everything for the interest of time, but all the detailed methodology of this is in the paper. But we essentially just wanted to see who is more likely to be water insecure and which variables are the strongest determinants. So this is a very simplified version of the model results. So the green lines show that these are the variables that had a positive and statistically significant impact on water security. And the red lines indicate that these are the variables that had a negative but statistically significant impact on water security. And then the symbols are for either men or women. So interestingly, for older men, actually, they were more likely to be, the older the men are, the more likely they are to be water insecure. For both men and women, if they are paying for drinking water, they're less likely to be water secure. And another interesting finding was that wealth levels only had a significant and positive impact for increasing men's levels of water security, while being employed, having higher education levels, and using an improved drinking water source had a positive and significant impact for women, which is really interesting and has broader implications for targeted programming for women. And then for both men and women, the more likely they were concerned about future water issues, the more satisfied they were with the drinking water supply and quality, the more likely they were to be water secure. So interesting findings, and just looking at gender on its own, it was only when it was interacting with these different variables where it impacted water security levels. So as I just mentioned, gender by itself was not the strongest determinant of water security in this model that in these models that we ran, but its interaction with the other variables played a stronger role in affecting water security. So really what our study was telling us is the importance of conducting these types of intersectional analyses when we're conducting this type of water research. So gender is not the only social identity which affects access to water resources and wash practices in this case. And we really want to be thinking about this idea of intersectionality and how different social identities are interacting to create different experiences of oppression. So, I mean, in some contexts, men are more water insecure than women. But we just would never know that unless we're conducting these more nuanced analyses. And then, of course, in Pakistan's setting and a lot of other places, access to and control over water and then wash services by men and women is largely shaped by social and power relations. So the key kind of takeaway from our study and what we're using in our advocacy work now is that improving gender water data is key. And there's this famous phrase of that we can't manage what we don't measure. And in Pakistan's case, that's absolutely true. We are not collecting enough disaggregated data, so we don't understand what's happening with women, with men, and with other gender groups. And it's not just enough to quantify, counting how many women or how many men, et cetera, but we also need to be assessing impacts of different wash interventions and programming. And what we're hoping, what we're trying to do with this study is one, contribute to this gender water gap in Pakistan. And we're trying to say that, the more we conduct these kinds of studies and we're building this evidence base, we're putting more pressure and creating more accountability with decision makers. Because right now we hear a lot like, oh, we just don't have enough evidence. We just don't have enough data. But the more we collect this disaggregated data, then policymakers or decision makers ignoring this evidence, that then becomes a deliberate policy choice that they're making or programming choice rather than just an oversight. So, and other kind of implications and takeaways, one, again, our findings support global evidence that women and girls are disproportionately affected by poor wash services and facilities. Another thing that we wanted to showcase is that, communities are not homogenous. And when we talk about community programming, we really need to dig a bit deeper and think about, okay, who makes up this community? If it's, a intervention that's being designed, who will have access, who will benefit, who won't. So even these two towns are really relatively small towns in Pakistan. So, but even then, people living in these same towns and similar areas, they had completely different water concerns and perceptions and experiences and levels of water security. So tools like the IWISE scale, there's also a household level one called HWISE. So using tools like these can help pinpoint these differences and better guide where intervention is needed and for whom. And then the last kind of takeaway that we are also using now moving forward in our programming is that we need to take gender considerations into account and not just conducting gender analysis and then writing a report, but using those findings to improve policy and improve programming. Because when planners or policymakers fail to account for gender interventions or policies, by default, they become male-dominated. And a perfect example of this is Pakistan's national water policy. There is no mention of gender in this policy at all. And there's only one clause that mentions women, and it's only in the context of domestic water management. So this is a perfect example, and this policy is supposed to be, you know, the blueprint for the country on improving water resource management and water security. So it's a bit troublesome that it's not taking gender into account. So I'll stop here, and yeah, I will share the paper link in the chat too, if anyone is interested in reading it.
Thank you for sharing that. So let's see, I'm going to actually ask Bonnie Zaire to unmute herself. We have a couple questions. So if we go to Bonnie Zaire, and then Yugasha, if you let me know in the chat if you want to speak yourself or if you want me to read your question. So go ahead, Bonnie, please.
Thank you so much for sharing this wealth of information with us. I have two questions that are just really asking you to elaborate. The first one is thinking that many of the folks here are not used to seeing how people take care of themselves outside when they are dealing with their menstrual situations. I was wondering if you could just explain that inside-outside statistic a bit more. And then the other question is, when you talked about how if you pay for water, you're actually more likely to be water insecure, which was not what I was expecting.
Yeah, so yeah, I should explain the question more. So basically the question was how easy it is for the woman to change and wash herself in private when she's on her period inside her house, and then the same question for when she's outside the house traveling or running errands. So that was the difference. And again, I mean, a lot of public toilets in Pakistan are not very MHM friendly at all. There's often not, you know, toilet paper available, or, you know, they might just be dirty. There's not soap available, you know, so that was a really interesting finding for us, at least, that public spaces also need to be designed also with women and other groups in mind. And then you asked about paying for water, correct? Yeah. So basically, the point of that was that, as I mentioned, so the Farash town gets free public water from the Capital Development Authority. So people in Rawalpindi or Jamestown, a lot of them are also they're using either filtration plants, or they're paying for water through private tankers. And the private tankers, they often hike up the prices as well. So that plays into it. And then actually, if you look at WHO's definitions of improved and unimproved drinking water sources, tankers are actually considered an unimproved source because they could be contaminated. So that also plays into that.
Okay, so now I'd like to ask Yugasha Bakshi to unmute themselves. They have a question.
Thanks, Sidra, for the very insightful presentation. I had a question about the water source in these particular communities that you shared with us. Is groundwater at all utilized as a water source? And if yes, to what extent is it utilized as a primary or secondary water source? And what are the factors that influence its use, or, you know, the lack of its use? Is it money? Is it finance? Is it the infrastructural requirement to kind of, you know, dig boreholes, stuff like that? Thank you.
Yeah, thanks for that. So the main water resources for both Islamabad and Rawalpindi are both surface and groundwater. And the water supply, so for Islamabad, it comes from nearby Simli Dam and Kanpur Dam. And then for Rawalpindi, it's Kanpur and Rawal Dam. So those are the main water sources. And groundwater has been depleting. So in Islamabad, it's been depleting 1 meter per year. That's the average rate. And in Rawalpindi, it's 2.5 meters per year. So the country nationally, not just even in the cities, but groundwater is slowly depleting. Pakistan only has 30 days of water storage, a 30-day water supply if we ran out of water. And I think like for the US, it's 200 and something, you know, just for comparison. So issues like climate change, like flooding, droughts, Pakistan also deals with a lot of droughts. This is all affecting the water supply.
Larry, can you go ahead and unmute yourself, and thank you for your question?
Yes, yeah, thank you. Thank you, Sidra. I was wondering, with the very stark difference in the measure of water security between men and women, if you were only surveying those men or those women who were responsible for retrieving water, or if you were measuring men and women's opinions from within the same household. In other words, does each man and each woman represent an entire household, or do you have men and women's opinions from within the same household?
Yeah, so the sampling was such that it was, we used the household as the entry point, and within each household we only were interviewing either a man or a woman. But for the IWISE scale, the questions are asked at the individual level. So there's also a household version of that, but we wanted to get the difference between men and women. So the questions are phrased that the person would be responding based on their own experiences. Yeah, I hope I answered your question.
Yes, thank you. I was asking that, I was wondering if how you distinguish between the perception of water security by a particular man or a particular woman and the actual water security of that household.
Yeah, I mean, we don't have a way of comparing that. I mean, this is just perceptions, the IWISE scale. We just kind of, we can make certain assumptions just based on what we know about the area, that these communities and the work that we do there. But we weren't, I mean, we haven't kind of, not in a scientific way have we measured, you know, what this household's water security levels are.
Thank you. That's good.
Okay, so we have another question from Deborah Rubin. Let's see, would you like to ask directly?
Sure. I think you answered it actually in responding to the previous two questions. It sounds like you don't have the data from what you said to Larry to know whether the actual water security differs for those households that have their own groundwater sources. But perhaps you know something about the perceptions of water security. I was building on both the question about the groundwater, which I thought was great because we don't know enough about gender and groundwater use. But also the data that you showed that said that men and women both reported insecurity, perceptions of insecurity if they had to pay for the water, but that wealth was related to a positive level of security for men or women. I'm sorry, I don't.
Men.
For
Yeah,
men.
for men.
Okay. So it costs money to put in a groundwater well. So I'm just interested in the connections there.
Yeah, I mean, we have the data because we asked each household what their source is. But for the model, it wasn't like it didn't sparse that out. But that's a very interesting question. So I will probably go back and see if there is any difference based on the water source, because we do have that information. It would just be a different type of analysis, but definitely something we can do.
Thanks. That would be great.
So I just want to read a comment from somebody who had to leave, Monami Haynes, but I thought it was a very interesting comment. They said I really appreciated your discussion about how gendered infrastructure prevents adequate menstrual hygiene management. So much of international MHM development initiatives focus on providing people with better personal menstrual hygiene management tools, low cost, often environmentally sustainable pads, not on the political work of improving surrounding infrastructure. Thank you for your talk. So, and we do have time. I don't see any more questions here. So this is, unless I haven't gotten to the bottom here. No. I don't see any more questions. So this is also, this is called the discussion series. And, the reason that it's a little clunky, the way we do this, is that we've insisted on keeping this as a Zoom meeting rather than a webinar so that we can have this interaction that isn't possible. Great. We have a question from Yugasha Bakshi again. So please go ahead and unmute yourself.
I was also interested in knowing, Sidra, what were the reasons behind choosing this particular form of framework for this exercise? Did you look into other frameworks, or what was it that appealed about the IWISE scale that led you to use that for this? Thank you.
Yeah, so these water insecurity experiences scales, so there's the IWISE, which is at the individual level. So the main reason we use the IWISE versus the household level one or any other scale for measuring water insecurity is that these WISE scales are really capture more like the human experience of water security. So they'll ask questions like, when in the last 4 weeks, did you ever have to, change your plans because of issues with water? Or did you ever feel shame or embarrassment because you didn't have enough water? So they capture more of the human experience of it, which the other frameworks that I've looked at just look at kind of, how much water they have or what's the water source. Like these type of metrics, I think don't necessarily capture the difference, especially the gender differences in water insecurity. So that was the main reason why we decided to use it.
We have a comment from Tuba, and I asked if they would like to speak or if I should read their message. No. Okay. Well, they were just very appreciative of this, but I don't understand what it means to have this from a non-weird, W-E-I-R-D, and super underrepresented setting. Thank you for your work. Does anybody know what that means, the W-E-I-R-D, non-weird? New message. Okay.
Yeah, I also just shared the link to the paper that goes into more detail of the modeling that we did for those who are interested.
Great. Western, Tom Archibald, weird is Western educated, industrialized, rich to democratic. Okay. And Tuba just said the same thing. Great. Okay, thank you. That's great. Well, we still have at least 5 minutes of Q&A discussion, so I'll have a question. Okay, so it was pretty striking to me that you said that the national water policy does not refer to gender at all. I'd like to hear more on that, and if you see any hope of that changing, if there's going to be another water policy. I mean, there's a lot of talk of water and gender and climate change in Pakistan and proposals and calls for proposals that we see. So it's kind of scary to me. Any comment?
Yeah, well, so Pakistan has so many policies related to water and climate change and adaptation. So the water policy was developed in 2018. And I'll also say though that the water sector is predominantly male dominated. So you're not, they're thinking more along the lines of kind of technical solutions. So I don't really know who was involved in the writing process of that, but it doesn't surprise me actually that they don't speak of gender. But part of the work that we're doing at IMI is, helping provincial governments implement the national water policy at the provincial level. So we've done a lot of trainings on how to make these policies more gender sensitive. But, that's just one policy. The national climate change policy does speak a lot about gender. It has its own separate gender action plan. Just last year, the country published their national adaptation plan. So that speaks a lot about gender. So I think they're getting better. but the issue again always comes down to implementation. And at the community level, are these things really, really going to happen?
So if we do not have other questions, I'd like, before I do my little closing ritual, I do want to ask Cedra if you have anything else that you thought of that you'd like to share with us based on the questions, or I know you were kind of limited in your 20-minute presentation.
Yeah, so I actually I spoke to Dr. Young a few weeks ago, who's one of the lead on the creating the IWISE scales. So she was telling me right now, right, the scoring is just water secure, water insecure, but they're publishing a paper actually that they've made it into 4 levels, which I think is a lot more interesting. So I think it's something from like low, moderate, high, very high or something. So that will be really useful, I think, because a score of 1 versus 11 is would still be considered in the same category, which is not not entirely accurate. So it would be interesting if we redo this analysis with those quadrants.
So Deborah Rubin posted another question. Are you going to ask, Dee? Seems like a discussion.
I was just curious about what your next steps would be.
In terms of this research?
Yes.
Yeah, well, so for the specific project, I mean, we've given the project teams like specific recommendations. So, they are part of the project is they are building filtration plants, for example. So one thing that we've said is, well, make sure you're properly having community engagement sessions on where the location of these filtration plants should be. Make sure that they have ramps so that they're accessible to people with disabilities or limited mobility, because usually filtration plants here, a lot of them are not accessible. So just some of these findings, we're trying to like translate these into practical things at the project level. And then for larger advocacy work, I mean, we're using this as kind of a case study, if you will, for our government counterparts to show them that, gender data does matter and it's important because you're learning very different things about community needs when we collect data this way. So we're also trying to develop more mechanisms for, training people in the government on how to collect this data, how to analyze it. Maybe they could implement the IWISE scale or, other similar tools. So we're trying to use this as our kind of jumping board for larger advocacy efforts.
Great. Okay, so thank you again. Thank you everybody for joining us. Thank you, Cedra. We're sharing a short survey in the chat, but Diaksha is going to put a link in there. And as I said, your opinion is very important to us. It really helps us seek funding for speakers and to, address interests of the community. So wanted to let you know our next event is October 17th. Dr. Brenda Bunabana will be joining us. She's an assistant professor in the Department of Geography and the Environment at the University of Texas at Austin. And she'll be talking about the local meanings of empowerment and lessons for gender inclusive agri-food systems programming in Uganda. Don't miss this one. It will be virtual as well, so you can join via Zoom. You can check our website for more information, but you can also let us know, it's one of the questions in the survey, if you would like to be added to our listserv, which we use to announce the discussion series events. So have a wonderful day, and we hope to see many of you again on October 17th.
All right. Thanks, Maria. This was really great.
Thank you so much. It was really great. I really appreciate your joining us.
Thank you. Bye-bye.
Take care.